Hello, my dear menopausal wonders. Welcome to the very first video tutorial on the symptoms of peri and postmenopause. This is video number 483, and I am just now starting to tell you about symptoms. Can you believe it? I mean, you probably thought that any education on menopause would delve directly into hot flashes at first flush. But you see, that's the thing. Any menopause anything that focuses first or most on hot flashes is not a menopause education at all. A real education would teach you what I will teach you today, which is the cold, hard fact that the symptoms and consequences of your female genitalia are much more common and significant than those of your hot menopausal body, otherwise known as hot flashes. So not only am I just starting to teach you about symptoms rather than diseases here at tutorial number 483, I'm also going to start with the symptoms that occur between your legs rather than the ones that occur above your legs. And you will see that there are many facets to the genital symptoms of menopause. They include your vulva, vagina, urinary tract, as well as your sex drive. And the number of videos I dedicate to your genital symptoms will greatly outnumber the videos I dedicate to hot flashes. Now, in my book, you will find that chapters 22 and 23 are dedicated to your vagina and urinary tract respectively, and chapter 25 is dedicated to your sex drive. But this first YouTube tutorial in this unit is unique to the YouTube videos. My goal is to put into perspective why you should focus more on your dry menopausal genitalia than on your hot menopausal body. And while I'm referring to the symptoms between your legs as dry genitalia for now, you will discover that there is much, much more to them than you can possibly imagine. And that's why genital symptoms are first and will consume the largest number of video tutorials of all the symptoms. Let's start with just a little reflection. If you mention the word menopause to anybody, what's their first reaction? Do they blush? Is there a difference in the way that men react versus the way women react? If it's a woman, does she respond or does she just remain silent? And if she says anything at all, what does she say? Does it have something to do with hot flashes? Take a minute to reflect on the typical conversation about menopause. The truth is that hot flashes are the only symptom familiar to most women. Now, this is not because hot flashes are the most common symptom, and it's not because hot flashes are the most bothersome symptom. It's because hot flashes are the only symptom women are willing to discuss openly. And hot flashes are the most openly obvious symptom to the rest of society. Well, this is a shame, because the symptoms that are most bothersome to women are those that do not occur openly. And while you have to open your legs in order to assess them, most women will not open their mouths to address them. So I want to present the long list of differences that warrant focusing more on your dry menopausal genitalia than on your hot menopausal body. And as usual, since we'll be comparing two things, we'll construct a chart to depict their differences. And I really like building the chart as we go along because it enables you to see how things are stacking up, item by item, rather than just seeing it all at once at the end. So here's the skeleton of the chart we will be filling in. Currently, the chart is blank and neutral in color, but we'll go through each of these items that make your dry menopausal genitalia much more significant and worthy of focus than your hot menopausal body. And we'll color code the chart as we go. Let's see, red is for stop and green is for go. So we'll use red to designate the worst symptom between your dry menopausal genitalia and your hot menopausal body. And we'll use green to designate the best symptom between your dry menopausal genitalia and your hot menopausal body. And when we're finished filling in the chart, the column with the most red cells will indicate which of these two symptoms is more significant and deserves more of your focus. So let's start with statistics. In other words, how many women have hot flashes and how many women have symptoms of dry genitalia? Well, only 50% of women have hot flashes, but a whopping 80% of women have symptoms due to dry genitalia. So on our chart, dry genitalia will be red and hot flashes will be green. This means that dry genitalia pose a greater problem for more women than hot flashes. Well, next is patient knowledge. How many patients know about hot flashes with menopause? And how many patients know about what happens to their genitalia with menopause? Goodness, this question forms the very basis for the title of this video tutorial. Almost all women have heard about hot flashes. For most women, it's the one and only symptom they associate with menopause. Most have no idea that there are over 22 symptoms of menopause. And even if they know there are more than just hot flashes, most have no clue that their dry genitalia will constitute several of their symptoms of menopause. So on our chart, we'll simply designate that women know about hot flashes but don't know about dry genitalia. And once again, hot flashes will be green while dry genitalia will be red. The next item is patient recognition. This refers to whether or not patients associate the symptom with menopause as the very cause of the symptom. Once again, almost all women recognize hot flashes as a symptom due to menopause. For most, it's the only symptom they recognize. But dry genitalia? Most patients are completely ignorant. They assume they have dozens of other things causing the symptoms of their dry genitalia, but they do not recognize them as symptoms of menopause. So, hot flashes are in green again, and dry genitalia is in red. How about talk? Do women talk about hot flashes? Yep, and that's pretty much all they talk about. But do they talk about their dry genitalia? Nope, they do not. Even though their dry genitalia will have a much greater impact on their lives, women refuse to talk openly about them. So, hot flashes are in green and dry genitalia are in red. All right, what if we shift from patients to physicians? Are most physicians familiar with hot flashes as a symptom of menopause? Sure they are. All they have to do is listen to their patients. But are they familiar with dry genitalia as a symptom of menopause? Well, it might surprise you to know that most are not. They are as clueless as patients. So hot flashes get the green color and dry genitalia get the red color. Well, if physicians don't know that dry genitalia are a symptom of menopause, do they recognize it when you complain about it? Do they connect the dots and tell you why you have dry genitalia. No and no. They're just like you. You don't know what you don't know. So hot flashes get the green color, and dry genitalia get the red color. How about patient embarrassment? Are patients embarrassed about discussing hot flashes with their doctors? Not at all. Patients readily complain about their hot flashes. But are they embarrassed about discussing their symptoms due to their dry genitalia? You bet they are, even with gynecologists. We gynecologists look at genitalia all day long. And yet, patients are embarrassed about discussing their dry genitalia. So once again, hot flashes are green and dry genitalia are red. Well, staying with the topic of embarrassment, are physicians embarrassed about discussing your hot flashes as part of menopause? Not at all. They voluntarily ask about hot flashes. But are physicians embarrassed about discussing your dry genitalia as a part of menopause? They are. If possible, they avoid the topic completely. Even though they look at genitalia all day, they are embarrassed about discussing them. So hot flashes are green and dry genitalia are red. Okay, well, how about subjective symptoms? Do you have something obvious to you to indicate that you have hot flashes? You do. You feel hot and you start sweating. And what about dry genitalia? Do you have something obvious to you to indicate that you have dry genitalia? You do. You have a multitude of signs and symptoms that I'll be discussing in these videos. So, for the first time on our chart, we have a tie. Both hot flashes and dry genitalia get your attention by producing symptoms that you recognize as wrong in some way. So on our chart, for subjective symptoms, we're going to use yellow for both hot flashes and dry genitalia. Well, then we come to objective symptoms. Do you have symptoms of hot flashes that are visible to others? You sure do. They see you sweat when it isn't hot. And how about your dry genitalia? Do other people know you have symptoms of dry genitalia? Or are the symptoms of dry genitalia something with which you suffer in silence because they are subjective only? Unfortunately, they're subjective only. So other people do not know that you have dry genitalia. They have no idea that they're part of menopause. So this takes us back to hot flashes in green and dry genitalia in red. Okay, symptoms are what you can see or feel. Signs are what your doctor can detect on exam. So now let's address objective signs. In other words, when your doctor examines you, can he or she detect that you have hot flashes based on the exam? No, they cannot. But they don't need to, simply because your hot flashes are visibly evident to you and everybody around you. So objective signs of hot flashes are unnecessary. But what about dry genitalia? When your doctor does a pelvic exam, can he or she see signs of dry genitalia? Yes. And I'll teach you all about them. Well, the fact that there are objective signs is a useful thing in terms of making a diagnosis. But we're not addressing diagnosis right now. We're addressing whether or not dry genitalia changes the appearance of your genitalia. And they do. And this is not a good thing. So it's good that you cannot see objective signs of hot flashes. That's green. And it's bad that you can see objective signs of dry genitalia. That's red. Next, we have diagnosis. In other words, do most women get a diagnosis if they have hot flashes? Yes! Any doctor will diagnose menopause as the cause of hot flashes. But do women get a diagnosis of menopause if they have dry genitalia? Typically, no. Instead, they get misdiagnosed as having a vaginal infection or a vulvar skin disease. When it comes to dry genitalia, doctors commonly miss designating menopause as the underlying diagnosis. So hot flashes get the green color, and dry genitalia get the red color. Well, after diagnosis comes treatment. If your doctor diagnoses hot flashes due to menopause, does he or she offer something for purposes of treatment? Yes, they do. In much later videos, we'll discuss whether or not what they offer is adequate for treating hot flashes, but they will all offer something. And what about your dry genitalia? If your doctor diagnoses dry genitalia due to menopause, does he or she offer something for purposes of treatment? Most often, not. And most often, instead of offering something to treat your dry genitalia, they offer something to accommodate your ability to have intercourse. In other words, they do not treat you. They treat your man. So when it comes to treatment, hot flashes are green, while dry genitalia are red. Okay, now we come to severity over time. This pertains to whether the symptom gets better over time or worse over time. Well, one of the very reasons you should focus more on your dry menopausal genitalia than on your hot menopausal body is that hot flashes tend to get better over time, but dry genitalia get worse. In fact, one of the reasons for the misconception that menopause is temporary is that hot flashes can improve over time. But that is not the case with dry genitalia. So when it comes to severity over time, hot flashes are green and dry genitalia are red. And that brings us to anatomic changes. Hot flashes are momentary events that do not entail any anatomic changes at all. They are merely temporary sensations. But dry genitalia entail massive anatomic changes. This is precisely why I'll give you more on genital symptoms of menopause than on any other symptom of menopause. So for anatomic changes, hot flashes are in green and dry genitalia are in red. Well, a consequence of anatomic changes is organ compromise. So that's the next thing on our list. This addresses whether the symptom causes a compromise in how an organ functions. Hot flashes do not compromise the way any of your organs function. They are merely a matter of short-term, momentary discomfort. But dry genitalia are a completely different story. Dry genitalia completely disrupt the function of your entire lower genital tract. They cause shrinkage and loss of organs. I'll be teaching you all about this in these videos in this unit. So we'll put hot flashes in green and we'll put dry genitalia in red. Well, what about timing? When in your menopausal life do hot flashes occur? And when in your menopausal life do dry genitalia occur? Well, hot flashes typically occur early in your menopausal life. They are part of perimenopause and early postmenopause. But dry genitalia are a part of late perimenopause and throughout all of postmenopause. So you are likely to notice hot flashes long before you notice dry genitalia. Now, one of the most important lessons of this education is recognizing the consequences of menopause early. So the fact that you have hot flashes early is a good thing. And the fact that you have dry genitalia late is not a good thing. And that means that hot flashes get the green color and dry genitalia get the red color. Well, after timing comes duration. How long do each of these two symptoms last? Well, hot flashes are commonly temporary or acute, but dry genitalia are typically permanent or chronic. So your hot flashes may come and go, but your dry genitalia will come and stay. And that means hot flashes are in green, while dry genitalia are in red. And what about the course of these two symptoms? Are they progressively worse or not? Sorry. In keeping with the title of this video tutorial, hot flashes are not progressive. They do not get worse over time. Quite the opposite is true. They tend to get better over time. But such is not the case for dry genitalia. Dry genitalia are progressive. This means they get worse and worse over time. So this warrants green for hot flashes and red for dry genitalia. And finally, we have the effect on your quality of life. How much do fleeting, temporary, non-anatomic hot flashes affect your quality of life? And how much do permanent, progressively worse, anatomically abnormal dry genitalia affect your quality of life? Can you tell just by the question which of the two has the greater impact on your quality of life? Hands down, it's dry genitalia. Hot flashes have only a minor effect on your overall quality of life compared to dry genitalia, which have a major effect on your quality of life. So we'll complete our chart by making hot flashes green and dry genitalia red. This chart is available via the link in the description box as well as at menopausetailor.me. And obviously it's not a very technical chart, but it's available should you want it. And as you look at the chart, do you see the big difference between hot flashes and dry genitalia? Do you see why the title of this video is why you should focus more on your dry menopausal genitalia than on your hot menopausal body? Why, oh why do women emphasize their hot flashes and ignore their dry genitalia? It is just such a disaster for women to focus on the wrong things. So this is why I'm starting the symptom videos with your dry genitalia and not with your hot flashes. So settle in to this focus on your genitalia. We will be addressing it for quite some time before moving on. And there are multiple areas of focus. They include all the following: your pre-menopausal genital anatomy, your post-menopausal genital anatomy, vaginal atrophy, vaginal infections, urinary problems, vulvar skin diseases, pelvic organ prolapse, libido, and orgasm. And I will present videos on each of these. So do not expect to get this education on your dry genitalia as a quick fix. Success at managing your dry genitalia requires an understanding of what's causing it in the first place. And that's what I'm going to give you. I will leave nothing unaddressed. The only thing I cannot and will not do in these videos is tailor the education specifically to you, because all tailoring requires a consultation, which you can schedule at menopausetailor.me. And it doesn't matter where you live, because I do them all online. So schedule your consultation at any time. You do not need to wait until I've finished presenting all these videos. Of course, even if you have a consultation that gives you all you need personally for your dry genitalia, don't stop watching these videos. Education is power. And the more you learn, the better you will manage your dry menopausal genitalia. Other than that, just be sure to subscribe to my YouTube channel and my newsletter. Everything I have to offer you is pure education. And education will ensure that you avoid pitfalls and burned bridges. So please come back in a week for an introduction to something called genitourinary syndrome of menopause. And until then, follow me on social media. Bye for now, my dears.